next speaker, Dr. Manra Naguib, and her talk is 8th and 9th TNM classification of lung cancer differentiation and clinical importance.
Good afternoon. My today's short topic is about 9th versus 8th classification of lung cancer differences and clinical importance. Lung cancer staging, that's a coalescing categories of anatomic extent, T, lymph node involvement M, and location of mets, the M. In January 2024, the 8th edition was replaced by the 9th edition of TNM staging classification. Although the T staging has not changing, it has played an important role in verifying the 8th edition of the staging, where it's from T1 to T4, including progressive size of the tumor and the same lung invasion. The N category of the previous N2 category in the 8th edition was replaced by N2A and N2B. N2A will denote single nodal station disease. N2B refer to multiple nodal station disease. Dr. Van Schell explained in answer to attendees' question that the concept of the station replaced the previous expectation of counting individual nodes. The two subcategories of N2 have produced new TNM subset with the different prognosis to be assigned to stage groups. Thus, T1 N2A assigned in the 9th edition to stage 2B, T3 N2A to a stage 3A, T2B N2B assigned to 3B, T1 N2B, T2A N2A, and T2B N2A remained in a stage 3A, T3 N2B and T4 N2A, and T4 N2B remained in stage 3B. In addition, T1 N1 was downstaging in the 8th from 8th edition 2B to a 9th edition 2A. This N2 splitting into N2A and N2B, and the new TN subset in the 9th edition of TNM classification, and the M splitting, we'll discuss it. The number of M1 subcategories will increase from 4 to 5 staging with the division of the previous M1C into 2, M1C1 and M1C2. M1C1 will denote multiple mets in a single extrathoracic organ. M1C2 will refer to multiple mets in multiple extrathoracic organs. Splitting of M1C1 to M1C1 and M1C2 in the 9th edition. The subcategorization of M1C1, M1C into M1C1 and M1C2 does not imply the change of the stage because both remain in stage 4B. Thus, the subdivision is relevant to refine the prognosis. Clinical relevance, the usefulness of classification system in clinical practice, highlighting the stage classification system, should providing clinically relevant information that can be used to guide treatment. The decision of splitting N2 into N2A and N2B and subcategorize M1C to M1C1 and M1C2 based on the evidence suggesting that the heterogeneous survival and different burden of the disease were inadequately described in the 8th edition combined categories. According to the 9th edition, the survival curve of the overall survival and recurrence-free survival within the adjacent stage grouping showing significant differences of the whole group. In a multivariable analysis after adjustment of the age, sex, and body mass index, a comparison of the overall survival revealed an increased difference between stage 3A and 3B in the 8th edition. This is a Kaplan-Meier curve showing the overall survival, A and B, and recurrence-free survival, C and D, by staging group according to the 8th edition and 9th edition of the TNM classification. In summary, the use of the 9th edition of the TNM classification system demonstrating improving prognostic accuracy than the 8th edition. Furthermore, the 9th edition exhibiting superior discriminancy power in predicting the overall survival and recurrence-free survival. We anticipate that these changes into the stage classification system will better describe current practice of clinical management and allow for deeper investigation of these triads in the future. And thank you.